Good evening. I'm Jasmine Thibodeau. Developing news tonight. The first measles death has been reported in the West Texas outbreak. State health officials say the school-aged child who was not vaccinated was hospitalized last week. According to the Texas Department of State Health Services, there are 124 confirmed measles cases so far in the outbreak, which started in late January. Most are kids, and 18 have been hospitalized. Now, back here at home, state health officials tell me that they are taking steps and prepared if we begin to see any measles cases here in Louisiana. Surgeon General Ralph Abraham says that 2 cases were reported last year in our state, but so far this year, there are none.
Just monitoring every public health unit that we have. Certainly, it's a reportable disease. So should an ER or a doctor's office pick up a case or even a suspected case, they'll let us know, and then we'll investigate it.
The Louisiana Department of Health reports that measles is one of the most contagious diseases, so contagious that unvaccinated people have a 90% chance of catching it if they're around an infected person. Measles spreads through the air when an infected person coughs or sneezes and can cause health complications, especially in kids younger than 5.
It starts off just like a cold, fever, runny nose, cough, congestion, just like any other little viral bug. At day 2 to 3, you can develop white spots on the inside of your cheeks.
And Dr. Danielle Douillon tells me by day 5, a rash develops on the forehead that moves straight down the body. She says complications can include pneumonia and brain swelling. According to LDH, after several decades of a highly effective vaccination program, measles was declared eliminated from the U.S. in 2000. Although there are still isolated outbreaks like what we are seeing in Texas. I asked Abraham if he's worried we can see an outbreak here.
Absolutely. We at LDH, and certainly from the Surgeon General's perspective, we are alert, we're ready, and we're very vigilant.
I looked at data, and as of February 20th, there were 93 cases reported in the U.S. according to the CDC, with 93% of those patients being unvaccinated. And now we're seeing the first death since 2015, a child out of Texas. What would you say to parents who are unsure about vaccines, especially in the light of the recent measles outbreak?
Vaccination is our best chance at preventing the spread of any viral disease. I would encourage anyone who has any questions or concerns to talk to a physician that they know, love, and trust to be able to make the right decision for their family.
Abraham agrees and says, quote, the MMR vaccine is a good vaccine. The first dose is given to a child between 12 and 15 months old, and the second dose between 4 and 6 years old. If you take a look at this map, you can see all of the states across the U.S. that are reporting cases of measles. And you can see that Texas is the darkest highlighted with the highest number of cases. And with Texas neighboring our state, doctors say they are concerned about a possible outbreak following Mardi Gras.